It's another day with the physicians where your health is our business.
Growth spot the end. So you are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what do you know is
You're welcome back to the training also on your regular program.
If you bleed and you complain to a doctor, the doctor must see you within 2 weeks. Anything after 2 weeks, your health is at risk.
Substance abuse isn't something you should take lightly. It occurs when you use alcohol, prescription medication, and other legal and illegal substances too much or in a wrong way. This can lead to physical, social, emotional, or job-related problems. Substance abuse differs from addiction. Many people with substance abuse problems are able to quit or can change their unhealthy behavior. Addiction, on the other side, is a disease. It means you can't stop using even when your condition causes you harm. On today's episode, we will be enlightened from our expert on your favorite health TV talk show, The Physicians. If you're just joining us, this is your regular health TV talk show, The Physicians, where your health is our business. On today's episode, we'll be talking about substance abuse and addiction. My name is Dr. Memuna Yusuf Kadri, and of course with my regular co-host,
I'm Dr. Martina Agberia. Welcome to The Physicians, where your health is our business.
Today we're talking of something that is very pertinent among our Nigerian youth. In fact, it's a big issue as it is with the UNODC report. We are beginning to understand that it's something that we shouldn't take lightly. It's something that we have to nip in the bud before it cascades into, other challenges that can be detrimental economically, financially, emotionally, and all that. Any case of recent that you've ever experienced on substance abuse?
Not a case per se, but the number of people that are actually abusing substances is on the increase. I traveled recently to a state, Delta.
Okay.
Wow.
About people.
When I got back, I told my husband, I said, you know what? We are in trouble. Real trouble. If you know, even the hotel that we stayed,
sometimes you will be perceiving like as if they don't even care.
We had to call the receptionist and told them that, you know what, this thing is actually getting to our room.
Imagine
you are not, yes,
you are not taking, you become a second, what they call it, called a second-hand user, because somebody else is actually taking it, and you are the one
it's even more detrimental
for you.
Because you're not the one taking it, it's more detrimental. And you can just see them, they use them, so young boys.
In 18 prime.
These ones were between like the ages of 18 to like 20, 21.
The problem with that is that it brings about violence, it brings about anger, it brings about all the kidnapping, banditry, insurgency issues we are seeing now. This, we already know scientifically it's linked to some of these substances that
as a mother, it's painful. Seeing these young ones go this route is very painful.
And the sad part is that you can actually request and it will be delivered to you the way a Uber or a boat can come to you. It's really
I don't know what the government is going to do about this. I don't know how they're going to handle it. Of recent was in the news that they found tramadol Of course, again in Delta and some other states, about 2
And,
other states involved.
and you find out that they come in truck load these days. Like, what is happening at the port? The worst part is the lady, I think it was early last year or late last year, who was making cookies with it and selling to school children. Anyway, we have an expert who is in the house, who is very passionate about, you know, topics like this and willing to share with us. And every one of us, even though we are medical doctors here, we are discussing a very important topic that each and every one of us need to sit down, learn, and of course, make sure that we do something about it, because it all begins in the home. We'll be right back after this time out. Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. On today's episode, we'll be talking about substance abuse and addiction. It's a major concern right now in the society, and we need all hands on deck. Today on the show, we are having a very amazing young lady who is passionate about, you know, spreading the word about substance abuse and addiction. She is no other person than Dr. MOTOLANI Oyerinde, a resident mental health physician and a member of Medical Women Association of Nigeria, Lagos State Branch. We're proud to have you here on board, Medical Women on board.
Thank you, Maris.
Welcome, Dr. Oyerinde.
Thank you.
So, Dr. Oyerinde, you've been schooling the word, substance abuse and addiction. People want to hear about it. What is it? What do you want to let people know? The first point, substance abuse and addiction.
Thank you. So, as we all know, substances are drugs or some other psychoactive substance. They are drugs that can either be gotten via prescriptions or drugs that are gotten from processed plants and also chemically processed. So when these drugs are abused, that is when they are misused beyond the level of prescription, or when as a psychoactive substance they are now used for pleasure and not for the medicinal benefits. So it becomes an abuse. And the process of substance being abused can come and lead to a disorder, where we now say this is now a substance misuse or substance use disorder. And these disorders can come in various ways. They can come in as acute intoxication, they can come in as harmful use, they can come in as dependence that would then lead to addictions, they can come in as hazardous use, they can come in as psychotic disorders where people can then begin to develop mental health symptoms that would need to be treated. They can also come in as residual symptoms that is affecting memory or leading to things like dementia or even affecting moods. So when we say substance use disorder, which we'll be discussing here, we'll take them one after the other so we can understand how this sequence goes. In acute intoxication, it can lead to things where the person begins to have sudden cognitive disturbances, that is disturbances in the way the person's mood is, the way the person's behaviors are, and also some physiological functions become affected. So in acute intoxication, that means the substance has been abused to a level beyond limit where the body system begins to react, both the brain and the physical body. In harmful use, it comes in a way where there is now problems with both the physiology and also the psychology. The physiology in terms of the way the person is now, the way the health is now affected. Okay. And harmful use can also lead to things like hazardous use in terms of alcohol, where the person takes beyond limit, and then the person begins to behave abnormally, such as driving at a very high speed. So in harmful use, it hasn't gotten to the level of dependence or addiction, but they are also of concern in substance abuse, because these are things we see in everyday life. We see it almost every day. By the way, for example, some of our commercial drivers may drive, or even some people on the way, they may be acutely intoxicated or may have used a substance that is now harmful to them. Then we go to dependence. Dependence is where this substance is now like an everyday thing. You've now developed tolerance to it. Tolerance is something that can even occur with our prescription medication. For example, we give you 2 paracetamol, and then you say, doctor, 2 doesn't work for me again. I use 4.
Really?
I use 4. Some people say they use 4 because they feel 2, the prescription you're giving them is not enough. So in dependence, you've developed tolerance. So for example, a person has begun smoking at a party, you just take a sip or you take a puff of cigarette. But you find out that over time, you can even finish 2 sticks alone. With time, to achieve that effect of being euphoric. Euphoric is a state of mind that after taking a substance, you actually are happy, but not in keeping with the real event. The reality, exactly. So you become euphoric, and then people now, to achieve that same effect of happiness, of that euphoric state or inspirational state, as some people say they use it for, maybe musicians, they use it to get inspiration. You now find yourself, you can now finish 5. You can now, progress to use some substance that are even stronger. For example, in cannabis, we start with the Igbo, which is the weed. And then from weed, people now begin to use their various brands, Arizona, some people begin to use Loud, Malikush. Before you know it, some people begin to mix Colorado too, the highly processed chemical with all these things. And the more you use them, the more you progress into, the more you change this substance to the higher, effect as developed tolerance, the more you can actually develop both the physiological and psychological issues.
Dr. Oyerinde, I'm sure people that are sitting down watching, they're like,
what is going on?
What is going on here?
You've actually enumerated a whole lot. And you call the names like, it's obvious you see them often.
Yeah.
Loud, Colorado. When you call Colorado, I can tell you you're talking about a state in the United States. They say Colorado, then there's Loud. It's frightening. Now you have talked about the acute intoxication, harmful use, dependence. I'm sure you still have a whole lot. Which are the ones that are mostly used in our own country, our environment here? Which are the ones that are mainly abused? The ones you see more.
Okay, so in our environment, we know there's something we call gateway drugs. So before anyone becomes, start using the other substances I mentioned and gets to the level of abuse or the substance use disorder, we call it misuse or substance use disorder or substance abuse. Before you get to that state, they must have had a gateway drug. For example, alcohol. A gateway drug is something that is just like a gateway. There must be an entrance to something. Okay. So it's something that would lead you, that would know, oh, this is a substance, I derive pleasure from it. That is exactly
like
what
the
gateway
first one that
exactly the first one you would take.
Open the gate.
So alcohol and cigarettes, that's nicotine, has been found to be the major gateway drugs, because most times we see due to, we call it peer pressure. Some people,
from peer pressure,
secondary school have started taking substance, whether at the valedictory service, end of year service, or even some of them, as I mentioned, in some cultures, maybe they've seen their dad. They may have a bar at home, and if you don't put strict measures and you give these children occasionally from maybe the age of 9, 10, 8, they may just see it as normal and steal it when you are not there. And before you know it, they enjoy it too. They steal it when you are not there. As they get to secondary school, they find friends taking it. And before you know it, they begin to get introduced to other substances by their peers. From alcohol, some of them can begin to smoke, and then can lead to other major substances like cannabis, like the methamphetamine, which is ice. Like Thailand, which is heroin. Like we have many other ones, tramadol, swinol, refnol.
Where will you classify this one? I heard of recent that there's this sweet. Because it's television, you can't mention their name.
Yeah.
The sweets and a soft drink.
No, I think maybe what she can even help us do is to categorize them in which ones are the depressants, which ones are the stimulants, which one are, that can also
now we know the gateway.
Now we know.
So the gateway drugs are, they can also become stimulants or depressants. So depressants, we can have alcohol in high dose, can be a depressant, and alcohol in low dose can be a stimulant.
True.
So that's
Okay.
an example. Stimulants like crack cocaine
Okay.
or cocaine in itself can actually be a stimulant. Then we have hallucinogens like cannabis in high dose, you know, can be an hallucinogen. So those are like examples. There are so many other
Oh, you say
substances.
stimulants. So I really need people to understand it. What does it do?
Okay. So
Exactly,
what
yes. What does it do? It's a stimulant. What does
okay,
it do?
so most of the
No, hold it right there. This is becoming very interesting, and let us get on the street with you out there on keeping up with the physicians and hear from you what substance abuse and addiction means to you, or if anybody you know that is taking, let's share. We'll be right back after this time out.
For me, drug misuse is like taking drugs that were not prescribed by the doctor, taking it for another purpose, like maybe to get high, and they were not prescribed by the doctors. But substance misuse is like excess taking of alcohol, codeine.
Drugs, they are mainly of pills. She get pills and syrups, and substance is more like alcohol.
Drug misuse, like when tablets and like drugs are being misused and mistaken, while some substance misuse like beer, cough syrup and etc.
We can say codeine. Codeine is always misused, like because codeine is for like catarrh, cough.
Youths nowadays, they take a lot of pills that are not prescribed by the doctors for them, even alcohols.
Cough syrup like codeine, beers.
Alcohol is very, very common in our society these days. And for drug, I can say marijuana.
I would say syrups and pills again. Yeah.
There's this thing they call ice.
Anything, peer groups, the kind of friends you keep can cause addiction.
I would say peer group, and sometimes depression too.
Peer pressure and depression.
Welcome back. If you're just joining us, we've been having an exciting time in the studio talking about substance abuse and addiction. And of course, the expert has been giving us what Nigerians call buzz. Why? Because we all need to hear this. Even if you know it, this should serve as a reminder. Dr. Oyorinde, before we went on this short break, you're telling us stimulant. And Dr. Agberi was asking, when you say stimulant, what does it mean? Because people need to know, in that relatable word or statement, why is this called a stimulant
and why is it
a depressant?
Thank you. So actually what we mean by a stimulant here is something that elevates your mood. Something that elevates your mood. That means probably you just notice there's a difference that you are happy about. You feel happy, you feel ready to mingle, let me put it that way, ready to, you just, not your usual state.
So you're happy as if you have money, meanwhile you don't have money in reality.
Exactly, in reality. That euphoria, that's what that euphoria is about. So the stimulant is more with many drugs, but it's higher in substances like crack cocaine. Some of these stimulants are things that you find out that people actually would want to use over and over again. Unlike depressants that probably can have this sedating effect like alcohol. Can help you forget about your worries.
Yeah.
That's
You wake up and face reality.
Yeah, you will sleep inside gutter as if it's like your palace, People
drive into the pool of water, thinking that it's
exactly. So those ones are like depressants. Depressants are things that will calm your worries, calm you down, have a lot of very excessively calming effect. But the reality about substance abuse is that they don't take away the reality. It's just something that, just helps you get that pleasure, that feeling of pleasure that is immediate and that you still keep going back to get it due to many factors. Peer pressure.
Okay.
If there is poor coping skills, a lot of stress that people cannot handle, this can also lead to it. Also, the environment, the cost, some of them are really affordable. Like you can get Igbo for, that's weed, the raw cannabis for 50 naira or 100 naira. You can get loud with 500
really
naira. You can get, you know, they are affordable. Though, you can get Arizona with 500 naira. Loud, I think 1,000 naira upwards. So they are kind of affordable. But people just, you know, the dependence level goes from tolerance to, you know, from the abuse, when you start using more than, then to tolerance, you know, then to dependence, then to addiction. Addiction, there's now what we
Addiction
call...
is the last. Yeah.
Exactly. We
And
now
that's a disease on its
is
own.
a disease. The brain is already rewired, because in most people, there's part of the brain, the frontal lobe, that gets developed about, you know, between the ages of 23 to 25. There are different statistics with the age group, but not below 20. So most teenagers or people that have begun to use substance, there's a rewiring to the brain.
Okay.
And then there's a part of the brain called the reward center that keeps craving, that keeps, you know, they need this, you know, reinforcement from the substance use, this positive reinforcement, and then most of them become dependent. So the earlier substance is abused, the higher the risks of dependence.
Okay.
So that's another thing. So it becomes a chronic disease, just like hypertension, diabetes. They need to be managed by specialists. They need to be treated. If not, most of them just become a societal menace.
So with all this that, you know, we've been talking about, how would somebody know that you are getting into an addiction? What are the signs and symptoms that people, you know, would watch out for?
Okay, so when you know you're getting into addiction, number one thing is you begin to crave the substance above every other thing. So there are normal, you know, pleasures that, you know, nature has created for us. The food, the sex, the, you know, other financial gains. You may have things that can bring pleasure to you. But now, in substance case, the amount of pleasure it gives you is even more than what sex can give you. It's even more. So that's when, what we call primacy, where people are addicted, that they just face substance. They don't even face women, their books or anything, because part of the substance use is the amnestic syndrome, where they can't even recall immediate events. So when they begin to have it, some people, that can be what may be affecting their academics.
Even the marriage.
Even
Exactly.
marriages and productivity in the workplace.
Exactly. So this comes into play. So the stage of getting into addiction or dependence is the craving starts. Then the tolerance we have mentioned, you just know that you will take higher dose. Now begin to take higher dose. Maybe from 0.2 gram of cocaine, you move to 1 gram per day, and they are not cheap.
Yeah.
So people begin to steal. They may spend all their salaries on substance.
Lie,
You know, do a lot of things, even prostitution. Some ladies don't think that they want to be, they just find pleasure from getting money to spend every day on substance. So then we go straight to what we call the withdrawal symptoms. Withdrawal symptoms occur when, you know, you want to stop the substance for a while, but the way you feel uneasy, you just say, and you just take your shot of alcohol, for example, as an eye opener, you feel okay. So withdrawal symptoms can come as agitation, can come as, you know, you just feel uneasy, even physiologically. That's your body normal functioning. But you feel, let me just really smoke in the morning before going out, or let me just really take a shot of alcohol. So the process just spirals down like that, where, you know, it now becomes an addiction. And it's so sad when, you know, it now leads to inability in functioning. So people can't function the way they should. Productivity, schoolwork for teenagers, they can't do their schoolwork the right way, or even the university student cannot focus. Then it leads to psychotic disorders can happen.
So this is where the mental conditions
can come in.
So at what point, for parents at home, you have talked about the telltale signs.
Yeah.
At what point should they seek help?
Exactly.
Are they before getting into the addiction? At what point should they seek help? And what the mode of management?
Yeah.
Okay, so for parenting, parenting is like, it's a full-time job.
It is.
And it has to be intentional. You can't just do parenting like, I know it, instinctive wife, yes. So parenting is a tedious job, and I give it to all parents out there, even my senior ones and myself that is a young parent.
Right.
But the most important thing is, once you are aware, no matter even if you are just suspicious, try your possible best to seek help.
Yeah.
Don't just say, oh, I'm suspecting this, and then you keep it to yourself, and you are waiting to see the stem, the things they used to take it. You are waiting to see the stick. You can't find it because the
children are smart. You know
what?
We want, before we round up, we know seeking for help is very important, but we want you to talk to that parent sitting down watching and listening to
Word
you.
of advice.
Word of advice. What do you want that parent action that he or she should take today?
Okay, so as a parent, the first thing I want them to know is it's possible for the child to return back to normal functioning. So there's no need to give up or begin to say, oh, probably somebody has affected my destiny. This is somebody has destroyed this child. Spiritual attack, they are useless for life. There's no need for you to think that way. Another thing you need to know as a parent is that you cannot stop your child from associating with the public. Because even from they must associate with their peers. But the most important thing is to understand this child's traits and to make sure that this trait, you can conform it to the positive societal expectation. Conforming it is by talking to them early. So imagine a teenager that is always saying, oh, I don't really like the way I look, or I want to feel among. They will definitely be influenced easily to use substance. So these are things you cannot take away from their relating with the society. But you can actually notice these behaviors early that can be helped. For example, your teenager may say, Mommy, my friends, they all have, maybe big bust. I think I'm the smallest in my class, or I'm the darkest, or I'm bullied. Don't take it for granted and say, you just, I know why all stress is, why in Lagos or Nigeria, why all stress, but see that as a reason to say, wow, this child has something that may bother him or her, and may now take it down to spiral into, you go and talk to a friend and say, just relax your mind, take this puff. Just calm down, whatever. Take this,
Thank you so much. It's obvious we need to bring her back because parents are going to watch this are going to we want to hear from that doctor again, because some of these things we've already started putting them into action, but we want to hear from her again. One significant thing I'm sure you should take away from this discussion is change. What has changed in your child today that wasn't there yesterday? And if you don't take charge, it may escalate tomorrow. Addiction is a process and never an event. Don't do drugs. It's a statement that each and every one of us must take in place. I remain Dr. Memuna Yusuf Kadri. Until next time, stay blessed.
It takes a society to train a child. You won't be able to do it alone. You are going to do a lot of disservice to that child if you don't seek help early enough. On this note, I say thank you so much for being part of our program. Until next time, remember to follow us on social media handles, on YouTube, on Facebook, on Twitter, and on Instagram. If you want to be part of this program, you are just a click away. Just go there and watch all the past episodes. And we also invite you to be one of our guests. My name is Dr. Martina Agbere. Stay blessed till next time.
Hello, my name is Dr. Isiawe. I'm an endocrinologist and the medical director for Rainbow Specialist Medical Center, Lekki. You're watching The Physicians. Make sure you stay tuned, follow them on YouTube and all the social media handles.